Receive my greetings. I hope that you are fine and that God has kept you safe. I'm also fine and I'm grateful. The other time, I did a video on recurrent yeast infections in women, what we call candidiasis. And today, I want to do yeast infection in men, what we call candidal balanitis. Before I continue with our today's topic of discussion, I would want to remind you something that we said one of the factors that causes a recurrent yeast infection in women is what we called estrogen dominance. Estrogen dominance, we said it's whereby the levels of estrogen are abnormally too high. Another scenario is whereby we have normal levels of estrogen but too low levels of progesterone. And so there is something that I want to introduce today, just for your information, that both female and males have estrogen. Female will have estrogen and progesterone alongside other hormones. Males will have testosterone, which is the dominant hormone in males, and also estrogen. And I want to let you know that testosterone is the precursor hormone. Like testosterone is converted into estrogen, a synthetic form of estrogen called estradiol, by an enzyme called aromatase through a process called aromatization. So this enzyme aromatase is found in the brain, in the skin, in the gonads or the genital parts, the ovaries and the testes, and also the fat tissue, the adipose tissue. So this enzyme called aromatase converts testosterone into estradiol, which is a form of estrogen. Therefore, we can say that testosterone is the precursor, it's like the raw material for estrogen production. But there is some contrast here. In males, the conversion of testosterone to estrogen is low. It's very low. That's why I've said testosterone is the dominant hormone. Wanaume wako na testosterone mingi kuliko estrogen. But after the conversion, some of the estrogen is reserved for brain function and also reproductive health, okay? And also for bone health. For bone health, for brain function, and also for reproductive health. Now, the process of aromatization or testosterone conversion into estrogen is very high in women. And that's why women will have a lot of estrogen compared to testosterone. Women also have testosterone. But again, when women have higher levels of testosterone, the male androgens, they will have a condition called PCOS, polycystic ovarian syndrome. So what I wanted to pass for your information today is that what we call the estrogen dominance can occur in both males and females. Males can have estrogen dominance because they have some portion of estrogen, and women also have estrogen dominance because estrogen is the dominant hormone in females. And therefore today, as I discuss candidal balanitis, I want you to have that in mind, that hormonal imbalance still applies in men. Because when we have higher levels of estrogen compared to testosterone, then the normal balance of the albicans, the normal flora in males will be affected. So what is candidal balanitis? Candidal balanitis is yeast infection in men. Men also have normal flora, what we call the albicans, in their skin, in their GIT, in the mouth. They have normal flora, they have that albican. But when we have overgrowth of those albicans, then we have yeast infection occurring. So Candidal balanitis will present with swelling, inflammation of the glans penis. Glans penis is the head, if I can say that. The head of the penis, the glans penis, can be swollen, can be inflamed, because that is where most of the albicans are found. So we will have inflammation around that glans penis and also under the foreskin. So inflammation of the glans penis is what we are calling the Candidal balanitis. So this Candidal balanitis is most common in uncircumcised men. Wanaume ambao hawajatahiriwa, it's very common. And also men who have compromised immune system. Wanaume ambao immune system yao iko na kasoro, it is compromised, although it can occur to anybody, but most commonly to those who are uncircumcised and those who have problems with their immune system. So what are some of the signs and symptoms of Candidal balanitis in men? Redness and swelling of the glans penis. Redness, the symptoms are the same. Remember what we said in women: redness and swelling, itching and irritation, kusikia kujikuna around the glans penis. We also have white discharge from your penis. We say that in women it's white in color, and we said it can be called cottage cheese. So the same, some discharge from your penis. Another thing is pain and discomfort during urination and sexual intercourse. Uchungu wakati wa kukojoa na wakati wa intercourse. A lot of pain. These are some of the manifestations. Another thing could be bad smell. Bad smell coming from your penis. Another thing could be what? Some cracks. Some cracks in your foreskin. You can check and see some cracks, small cracks. Alongside also some small red spots. Unaangalia unapata some red spots. Those are also, it is also an indication of Candidal balanitis. Okay, so these are some of the signs and symptoms. Men, check yourself very well if you have these signs and symptoms. Now, before I move on, I want to let you know that, as I said, we have these albicans in the mouth. We have these albicans in the GIT, the GIT from the mouth all the way to your anus. We have those albicans, the stomach and every part of the GIT, yeah, digestive system in layman's language. So that means we have some of the albicans in the mouth. And I want to warn people here. Please, I want to warn people here. I pity those people who have the tendency of licking the private parts of their partner. You are licking the private part of your partner. Men inserting their tongues in the vagina in the name of sexual romance. Do you know you can, in case that woman has a yeast infection in the vagina, you will lick them and introduce them in your mouth. You will bring imbalance in your mouth, and the albicans in the mouth will also be affected, and you will suffer from oral thrush, oral candidiasis, what we call oropharyngeal candidiasis. And the same with women who lick the penis of their partner. Imagine this man has Candidal balanitis. You are licking it. You are introducing the yeast in your mouth. You can suffer from oral candidiasis, and this can also lead to oral cancer. And you can also swallow and affect your stomach. You can have stomach problems and even cancers of the GIT system. I know this can be controversial, but don't risk your health in the name of satisfying your partner. Kama atosheki na kenye mnafanya, achana naye. You are risking your health. It's very bad. I condemn it, by the way. And this is the truth. I know people don't like the truth, but this is the truth.